Schizophrenia. Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. When schizophrenia is active, symptoms can include delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. Schizophrenia is a serious mental health condition that affects how people think, feel, and behave. It may result in a mix of hallucinations, delusions, and disorganized thinking and behavior. Attention deficit. Attention deficit, hyperactivity disorder, ADHD, is one of the most common mental disorders affecting children. Symptoms of ADHD include inattention, not being able to keep focus, hyperactivity, excess movement that is not fitting to the setting, and impulsivity, hasty acts that occur in the moment without thought. The precise causes of ADHD are unknown in the majority of cases. For most people with ADHD, many genetic and environmental risk factors accumulate to cause the disorder. Wonderland Syndrome. Alice in Wonderland Syndrome, AIWS, describes a set of symptoms with alteration of body image. An alteration of visual perception is found in that way that the sizes of body parts or sizes of external objects are perceived incorrectly. The most common perceptions are at night. The cause of Alice in Wonderland syndrome is currently not known, but it has often been associated with migraines, head trauma, or viral encephalitis caused by Epstein-Barr virus infection. Obsessive-compulsive disorder. Obsessive-compulsive disorder, OCD, is a long-lasting disorder in which a person experiences uncontrollable and recurring thoughts, obsessions, engages in repetitive behaviors, compulsions, or both. People with OCD have time-consuming symptoms that can cause significant distress or interfere with daily life. However, treatment is available to help people manage their symptoms and improve their quality of life. Jerusalem Syndrome. Abstract. Jerusalem Syndrome is a mental illness rarely seen in people who visit Jerusalem, manifests itself with obsessive religious thoughts, delusions, psychotic symptoms, and some characteristic features. In clinical practice, it's uncommon to encounter patients displaying symptoms of the Jerusalem Syndrome. Social anxiety. Social anxiety disorder is a common type of anxiety disorder. A person with social anxiety disorder feels symptoms of anxiety or fear in situations where they may be scrutinized, evaluated, or judged by others, such as speaking in public, meeting new people, dating, being on a job interview, answering a question in class, or having to talk to a cashier in a store. Bipolar disorder. Bipolar disorder, formerly called manic depressive illness or manic depression, is a mental illness that causes unusual shifts in a person's mood, energy, activity levels, and concentration. These shifts can make it difficult to carry out day-to-day tasks. There are 3 types of bipolar disorder. All 3 types involve clear changes in mood, energy, and activity levels. Alien hand syndrome. Alien hand syndrome is a phenomenon in which one hand is not under control of the mind. The person loses control of the hand, and it acts as if it has a mind of its own. The etiology includes neurosurgery, tumor, aneurysms, and rarely stroke. This case is presented to create awareness of this interesting clinical scenario, which can be terrifying to the patients and confusing to the physicians who are not aware of it. Agoraphobia. Agoraphobia, agoraphobia, is a type of anxiety disorder. Agoraphobia involves fearing and avoiding places or situations that might cause panic and feelings of being trapped, helpless, or embarrassed. You may fear an actual or upcoming situation. For example, you may fear using public transportation, being in open or enclosed spaces, standing in line, or being in a crowd. The anxiety is caused by fear that there's no easy way to escape or get help if the anxiety gets overwhelming. You may avoid situations because of fears such as getting lost, falling, or having diarrhea and not being able to get to a bathroom. Hypersexual disorder. Sexual addiction, hypersexual disorder, is used as an umbrella construct to encompass various types of problematic behaviors, including excessive masturbation, cybersex, pornography use, sexual behavior with consenting adults, telephone sex, strip club visitation, and other behaviors. The adverse consequences of sexual addiction are similar to the consequences of other addictive disorders. Addictive, somatic, and psychiatric disorders coexist with sexual addiction. Jumping Frenchmen. The Jumping Frenchmen of Maine were a group of 19th-century lumberjacks who exhibited a rare disorder of unknown origin. The syndrome entails an exaggerated startle reflex, which may be described as an uncontrollable jump. Individuals with this condition can exhibit sudden movements in all parts of the body. Jumping Frenchman syndrome shares some symptoms with other startle disorders. Individuals with this condition were first found in the Moosehead Lake region of Maine and were first described by George Miller Beard in 1878. Paris syndrome. Paris syndrome is a cluster of psychiatric symptoms exhibited by some individuals when visiting Paris that can be viewed as a severe form of culture shock. The syndrome is characterized by symptoms such as acute delusional states, hallucinations, feelings of persecution, perceptions of being a victim of prejudice, aggression, hostility from others, irrelevant citation, derealization, depersonalization, anxiety, as well as psychosomatic manifestations such as dizziness, tachycardia, sweating most notably, but also others such as vomiting. Piblokto. Piblokto, also known as Pibloktok and Arctic hysteria, is a condition most commonly appearing in Inuguit, Northwest Greenlandic Inuit societies living within the Arctic Circle. Piblokto is a culture-specific hysterical reaction in Inuit, especially women, who may perform irrational or dangerous acts, followed by amnesia for the event. Piblokto may be linked to repression of the personality of Inuit women. The condition appears most commonly in winter. It is considered to be a form of a culture-bound syndrome. Wendigo Psychosis. Wendigo Psychosis, characterized by psychiatric manifestations such as paranoia, anxiety, hallucinations, and cannibalistic urges, often emerges as a result of a fusion of cultural narratives and psychological vulnerabilities. This may provide an outlet for individuals experiencing internal distress. Historical records show that instances of Wendigo psychosis and cannibalism were more prevalent during periods of extreme scarcity and famine among Algonquian tribes, but they can also manifest in non-famine contexts. Narcissist. Narcissism is a self-centered personality style characterized as having an excessive preoccupation with oneself and one's own needs, often at the expense of others. Narcissism exists on a continuum that ranges from normal to abnormal personality expression.